Hello, everyone. I'm Dr. Diana Bitner. I'm co-founder of True Women's Health and physician at True Women's Health. And tonight we're here to have a let's chat about what your health is worth. And I really want you to leave tonight thinking about what your health is worth and if you're doing what you can do to have what you want. The reality is that women just do not prioritize their health. And when I ask my patients, how much have you prioritized your health in the past? They say, well, I go to the doctor once a year and I have my pap and my pelvic and my breast exam, maybe get a couple tests ordered, renew my prescriptions, and I'm out the door. If I get my blood work done, maybe I'll get a postcard in the mail that says, maybe you should eat better, your cholesterol is up a little bit, or maybe you should watch your weight. And I just feel that that is not adequate. We need a shift. Again, it's not a yearly check, but in terms of prioritizing our health, I believe that women just don't do enough. And I started True Women's Health to change this. My mission is to reach women everywhere to let them know it is possible to age like they want. The current system is just not focused on prevention. And preventative care has in the past gotten a bit of a bad rap because, what does that mean? To me, that means getting in front of conditions that we know are very likely to happen. And what I would ask is, instead of focusing on problems with short visits, can we get in front of what you are likely to have and how can we help prevent that? I ask, what has the current system done for women who have menopause symptoms? I saw a patient today who said all of her friends think it's just part of aging to have to go to the bathroom every 30 minutes. And when they go out in the world, they know where the bathrooms are everywhere. I said, that's not a part of aging. People think it's normal to be struggling with bladder infections, with painful sex, those menopause symptoms that, again, maybe your mom suffered, but you don't have to. I would ask, what has the current system done for all the women who die of preventable heart attacks, preventable strokes, preventable dementia? We know that 80% of healthcare dollars are spent on prevention. And if we weren't spending 80% of healthcare dollars are spent on treating conditions that could be prevented. So when something like a pandemic happens or a bad car accident, where are those healthcare dollars? They've all been spent on conditions that could have been prevented. So I would ask, what has the system done for the hip fractures that never had to happen, the falls that never had to happen? I would ask, what is the current system doing to treat all the symptoms of the midlife transition? Unfortunately, women can feel so on the sideline with these conditions. And if you just have a 15-minute appointment every year, when did you get to ask about the weight gain of midlife, the mood changes? I had a patient who got kicked out of the grocery store because she went postal in the checkout lane. And she said, can you help me get back into the grocery store if we get my mood stuff under control? I said, no, I can't get you back in the store. But how about let's not get you kicked out of any other stores? This mood stuff that you're experiencing, it can be very normal associated with the perimenopause or the midlife. Let's get this under control. It sounds like you don't want to age like this. And so with her, we were able to make a real difference. What is the system doing? And again, I would argue that there is so much opportunity because women don't have to suffer. It's all about, again, getting in front of it. You don't have to experience what your mom did. This is not your mother's menopause. Especially now with the pandemic, it's been in our face that if we don't have our health, what do we have? Especially now, we need to put ourselves first. We want to take care of everyone else. We want to keep our job going. We're worried about the economy. We're worried about what's happening with our kids. I have a recent college graduate. It's a whole new world to try to find a job. It's a whole new world to navigate. And so we're learning that if we don't have our health, what do we have? And also, the healthier we are, the more likely we're to be able to be resilient to fight the infection, if heaven forbid that we get it. So it's about putting ourselves first and taking the time and energy to do that. Remember, we want to stay ahead of things. So are you connected to your healthcare provider? And are you connected to your healthcare team? We need to change how we think. It's time for a paradigm shift. It's time to put our to be attached to your team, to be involved with your team 24/7. And at True, we started this to allow women to be in the center of their care. To be the center of their care, we focus on a system called waypoints. WAI means who am I? At True, it's not about our goal for your health. It's about your goal for your health. And I think that, for example, midlife and menopause can be that opportunity that really gets you thinking about who am I? And maybe I put my dreams on hold to take care of my family, to get my career going, to take care of my mom who is not doing so well. I've put everyone else first, but now, boy, I'm really not feeling great with the symptoms of menopause. So this is the time that we can think about, who am I? And at True, we also have a proprietary app that allows women to really think about themselves. Before patients come into our clinic, our True Women's Health Clinic here in Grand Rapids, we have people fill out their intake form on the app. And there are parts of it that are a little lengthy, but patients come in and say, wow, that really made me think about my health in ways that I never have. I have now thought about how I want to be in the future. I've thought about, wow, I don't want to have a heart attack like my mom did. Wow, I don't want to have dementia like my grandma did. And so again, we really want women to be in the center of their care. And this app also allows women to have that 24/7 access. While I've been sitting here, I've gotten several texts from my patients, which I will answer right when I'm done. But it's that way that we can have that quick contact, quick question. People just want answers. They want to know why. And again, it's time to put women in the center of their care so they can know why their changes to their body is happening. We at True want to be that one-stop shop. We want you to understand your health. We want you to know yourself better than anybody else. And we want to know you, but we want you to know you even better. We have lots of tools at True Women's Health. One is the symptom circle. A lot of you have already seen this, but I invented the symptom circle because I didn't want you to think you were crazy. Around the outside of the symptom circle are all the symptoms of midlife and menopause. And in the cutout circles, you can see what makes them worse and what makes them better. So it's a way to really understand what you can do yourself to make your symptoms get worse or better. On the back of the symptom circle, I know it's with a glare, it's kind of hard to see, we have the seeds, the 7 essential elements of daily success. And these are the list of things. Again, it's not about a quick fix, but it's about having these habits that really make a difference every day in your life. So that's another tool. We also have another tool called the sex deck. The sex deck is a way to make the conversation about sexual health more comfortable. Sexual health can be a very confusing topic. We know that 80% of women have concerns about sexual health, but only 20% will bring it up with their provider. We know that 80% of providers, physicians, nurse practitioners, physicians' assistants, know that sexual health is a big deal, but only about 20% will ever bring it up. We might ask you in that questionnaire, but we might not bring it up even if we read that you're having a hard time because, boy, there's not enough time to get to that. And, I don't know what to say anyways. So that sexual health is difficult. And over the last couple of weeks, I've been able to pull out that sex deck, which has 27 reasons for low sex drive. And it's been a great tool to talk with my patients about sexual health. And what they've loved is we isolated the reasons that they think they might have low sexual desire, and they can bring those cards home to their partner. And this is a really nice way to talk about it without the blame game, whose fault it is that they haven't been intimate lately. And that's become a really difficult topic. So that's another tool. Again, I've talked a little bit about our proprietary app called True Woman. True Woman allows women to, again, set some goals, answer questions about their health in a way they've never thought about, think about their family history, think about their personal history. And so it allows everyone to put everything into the app and then to really be able to have that in place when they come into the office. When you come into the office as the patient of True, we don't have to ask questions that you've been asked 20 gazillion times because I've read your app before you come in. We already have the chart preloaded. And so then we can really focus on what is it that you want to walk out of here today. And especially if you join our total wellness program, You can come in as many times as you want during the year, and you can access on the app, and we can really do a deep dive into your health and what you want. And again, it's a way that we can stay in touch and we can really, again, do a deeper dive and help you reach your goals. Another tool we have is the workbook. So the workbook, this is my baby. It really puts it together. And I always had wanted, it's here now, I always had wanted to create a system to allow you to think about your health in a different way. And I'll point out to our patients, the book is called I Want to Age Like That. Your that is different than my that. So how I want you to age doesn't matter. I want you to keep doing what you want to do as long as you want to do it. And so I Want to Age Like That is the title, again, to help you think about it. And as you go through the workbook, which is also available on Amazon, but if you come to the clinic, then it's provided to you. But it goes through and basically you're thinking about, what is your family history? Tell me about the women whose shoulders you stand upon. Tell me about the women who have come before you and what they did that you might want to copy, you might want to age like. But sometimes there's things like, I don't want to age like my mom, bless her heart, but I want to age better. And she didn't have the resources I have now, and I want to take care of that. So again, we want to do it different. We talk in the workbook about when midlife happens and menopause happens, why symptoms occur. And then you can think in your life, what might be triggering those symptoms? If it's just hormones, maybe it's because you gained 10 pounds, maybe it's because you're not drinking your water. So we want to put the knowledge in your hands. But everything at True is all about guiding you to develop your picture of self. So we want you to think about, how do you want to be at a milestone event? How many people out there have actually thought about that? I think there's like 3 kinds of women, is what I've seen. Women who think, I'm gonna get diabetes, everybody else did in my family. I'm gonna have a heart attack, everybody else did. I'm gonna get breast cancer, everybody else did. And so I'm just gonna kind of do my life and I'll deal with it when it happens. No, that doesn't have to happen. Maybe back in the day when there wasn't good prevention, there wasn't good medicine, there wasn't that knowledge that allows us to get ahead of things. We have that now. Take advantage of it. Then there's the kind of women who say, yeah, I'll never get that. That was my mom. That was back then. I think she didn't care. Bull. She cared, but maybe didn't know what she could do about it, or she was too stressed to focus on her health because of whatever she had going on. The point is that it could happen to you. I was scrolling through Facebook yesterday and I saw this lovely picture someone had posted of their mom and dad when they were very young and they eloped. They were passionately in love. It was a big scandal at the time, and they eloped and they got married. And then there was another picture of them that when her mom had dementia, had Alzheimer's, and her dad was kissing her and she was lamenting that they had passed. And she found this picture as they were cleaning out the house of them when they were young and passionate, and now, when they were older. And it made her realize, wow, aging really does happen. Nobody's going to get out of here alive. We're all going to age. So we get to choose how that happens. We get to choose how we age. And for example, if you're at very high risk for breast cancer, it is so important to catch it early. Do you know what your risk is? If heart disease is a big issue in your family, have you had a coronary artery calcium score? Do you know what your risk factors are? At True, we go under the surface and we work hard to figure all that out. So also as we go through the app, it goes through each thing in terms of how do you want to be, in terms of your weight. You want to be a 3 or a 2 or a 1. It's not a competition. Not everybody has to be skinny to be happy and healthy. Maybe you're okay being a 2 or even a 1. But then let's focus on health in every other area. We go through bones. Do you want to have strong bones at low risk for fracture, or are you okay with high risk for fracture? So that sounds a little silly, but the point is that I want women to know you have choice. And then we give you the tools to figure out what you have to do. And if you're at risk, we do testing and we figure it out. And then we make a plan. At True also, we have a team of specialists in the area that we refer to if we have deep, conditions that we need to go deeper. So I don't pretend to know everything. I have great experts in town that know if we need help, for example, preventative cardiologist, bone health specialist. If you don't exercise because your feet hurt, let's have you go see the podiatrist. So we really want to solve for barriers. I work a lot with a PT group called iMove. So what they do is functional physical therapy. If you're telling me you're not going to work out because your hip hurts, let's figure that out. Let's get ahead of it. Let's not just suffer the consequences of a pain that you don't know why there is. So again, I think there's three types of women. Women who think it's going to happen. Why worry about it? I'm just going to deal with it. Women who think never going to happen to me. I'll think about it tomorrow. And then there's those women who really have a plan. And I can think of two women right off the bat that I want to be like them when I'm 80. They're 80 and they've been planning their whole life to be healthy. The one woman I'm thinking of, she learned early on that diabetes was a big issue in her family. She did research. She had to do it on her own, but she did the research and she totally changed her diet. She changed her exercise and she had discipline. I love thinking about discipline in a way of it's doing things that you at the time would really rather not do. So for example, I wanted to be a doctor more than anything. So I studied a lot, and my friends would tell you too much. I missed out on a lot. I don't know many things about music or movies in the 90s because I was studying the whole time. But I had that discipline to study even when I didn't want to, because I so wanted to be a doctor, and it's paid off and I love it. And thank goodness my friends stuck with me. So I want you to want to exercise even when you don't want to, or I want you to exercise even when you don't want to. So you might feel a little tired. You might have something else that's more fun to do, but discipline is getting that exercise in. It doesn't have to be an hour. It can be 20 minutes, but it's making sure you have that discipline to do what you need to do. So sometimes would it be better to, it'd be more fun to have a juicy steak and steak fries and 2 glasses of beer and a big piece of chocolate cake. But having the discipline to have a piece of salmon with a salad and a glass of wine as your one treat for that day, it's still yummy and wonderful and fun, but you made a choice that now will change your life. It's having that discipline to do what you don't want to do in order to reach your goals. I could talk about this all night, so I'm getting off track a little bit. But I want you to think about, so what does this mean in terms of what is my health worth? So in terms of what your health is worth, are you willing to spend the time to think about this? Are you willing to spend the time to fill out your intake form on the app? Are you willing to do the workbook and really put some thought and energy into how do I want to be at that future event? How do I want to be when I'm 80 or I'm 90? I personally still want to be very active. I don't want to be dependent on my kids, on my people. I want to do everything myself. So I have a clear goal of what that looks like. It's spending that time. And at True Women's Health, it's also to think about how can I do things differently? Unfortunately, the current system is often limited by insurance in terms of insurance mandating which medicine, how much time you spend, when you get to go to the doctor. And at True, we're doing things differently. We're asking you to pay a portion of your care up front. And then as you come in, we bill what we can. We give you a receipt to turn in your insurance company. It's a completely different way of thinking, but you'll get your money's worth. We spend the time. You have access to our providers. It's myself and Suzanne Pettigrew, who's a PA, and she is amazing. Suzanne specializes not only in primary care of women, but also in high-risk breast assessment for breast cancer. And also she started the cancer survivorship program at 2 hospitals here in West Michigan. And I can't say enough. My patients who see her love her and often then want to see her and not me, which is great. So we have a wonderful team at True. And again, you'll get your money's worth. It's a different way of thinking about healthcare. And so, we can walk you through that, but again, it's having that availability. And so in terms of another tool that we use at True, we have our special scale that does body composition. So it does body composition for belly fat, for fat percentage, muscle percentage. And what I want to offer is I really want you to come in and see our clinic and meet our team. And so if you want to call and schedule a tour, if you want to stand on the scale with body composition, and it also, by your body fat and your body muscle mass, it gives an estimation of your body age. There are more specific ways to do that as well, but this is a rough estimate by your body fat percentage, what your body age is. It's amazing what that can do in terms of being eye-opening. So if you're out there and have questions about True and want to see what it's like, again, we offer that you call our number, and it's right on the website, and contact us, come in for a tour, and experience what it feels like at True. When women come into True, they say, this is so much more than I expected. This is not just that yearly exam. This is where people really get into, tell me about myself and what can I do to age like I want. That's what we do at True. And so it's, we think about, we prioritize other things to feel good. We get our nails done, we get our hair done, we buy expensive skincare products. But when do we prioritize our own health? And we think about taking care of our animals and taking care of our kids. That all is important, but when do we focus on our health? So I'm looking at questions on the side. Thank you for your comments, Linda, about women's health and your experience. Again, I so love what I do. And I feel so lucky to be a part of this team and to allow you to do a deeper dive in your health and to really understand, and again, age like you'd like. Just checking to see if there's anything else I wanted to talk about. Again, it's about putting yourself in the center of healthcare. And when we say, what is your health worth? Again, it's not just talking about the financial piece. It's about what is your health worth in terms of your time and your energy. And we at True want to be part of your healthcare journey. So please feel free to ask more questions about our model, to experience our website and get a sense of what we're offering. We have other podcasts and videocasts on our YouTube channel, as well as the Facebook page. And we really look forward to your comments and your questions. And we look forward to meeting you at True Women's Health. Thank you and have a good night.